right, and go ahead, Tim.
Well, good morning. I'm Tim Sheehy, president of the Metropolitan Milwaukee Association of Commerce. MMAC envisions a globally competitive region that fosters high-value employment to sustain a vibrant quality of life for all. For the past 10 months, we've been hosting this podcast, Business Strategies During the Pandemic, and we certainly had no idea it would be this topical this long. But it seems like we're finally seeing some light at the end of this long tunnel with the first release of the COVID vaccine. And we'll discuss what this means with our regular guest, Dr. John Raymond, president of the Medical College of Wisconsin. We'll also get a peek into what this means for the economy and the recovery in 2021 with our special guest, Manuel Rosado, president of Spectrum Advisors. And we'll also discuss some of the legal implications for employees and employers related to COVID with our special guest, Brittany Lopez Nalid, a shareholder in labor, employment, and litigation practice with Reinhardt, Borner, and Van Duren. But before we start with Dr. Raymond and get to our guests, as they say, we've got a couple words from our sponsors. Reinhardt, Borner, Van Duren is a full-service, business-oriented law firm with offices in Milwaukee, Waukesha, Madison, and across the country. They're dedicated to helping address the critical issues of our time by delivering innovative, cost-effective solutions to the challenges we face together. With more than 200 attorneys across a wide range of practice areas, Reinhardt has the experience necessary to help clients stay abreast of emerging trends, protect their corporate assets, minimize risk and liability, and execute sound strategies to achieve business objectives. Today's program is also sponsored by United Healthcare. In times like these, a traditional health plan may not be the best fit for your business. So take a closer look at All Savers Alternative Funding from United Healthcare. MMAC has partnered with United Healthcare to offer coverage for groups of 5 to 99 employees. Now small businesses can take advantage of benefits typically reserved for larger companies. Underwriting for more competitive pricing, better data so your business understands where your premium dollars are going, and a potential refund if claims are lower than expected. So contact your broker or visit uhc.com/MMAC to learn more. And finally, thank you to Spaces, which is serving as MMAC's temporary home during our office relocation. With over 3,000 global locations and 10 in Wisconsin, Spaces makes it easy to have a productive day at work. So let's start, as we usually do, with Dr. Raymond and get an update on what I've described, Dr. Raymond, as light at the end of the tunnel.
Yeah, thanks, Tim. And there is light at the end of the tunnel. Before we get started, though, I just want to say thank you to Chris Jenkins, who works behind the scenes to advance the slides and make sure that our presentations go smoothly. Chris, thank you for everything that you've done. And with that, could you move to the next slide, please? And then the next one. Thanks. I just want to start with a summary from Worldometers, one of my favorite sites to track COVID-19. These are 3 screenshots from yesterday that show the burden of coronavirus in the world, the US, and in Wisconsin. And as you can see, we're approaching 74 million cases in the world, almost 17 million in the US, and nearly 440,000 cases in Wisconsin since the beginning of the pandemic. That translates into 1.6 million worldwide deaths, 307,000 of which have occurred here in the US, and 4,000 in Wisconsin. In fact, we passed the 4,000 mark this last Saturday. And there's still a substantial case fatality rate, ranging from 2.2% in the world to 0.9% here in Wisconsin. And to put that in perspective, that's around 10 times higher than the seasonal influenza death rate. And that would also be without masking and the types of interactions that we have to try to prevent the spread. On the other hand, many people have recovered. In Wisconsin, we have nearly a 90% recovery rate with 390,000 people designated as recovered. As I always say, I want to make sure people understand what that means. Recovered means that most of the symptoms have resolved or the individual is 30 days out from their diagnosis. It doesn't mean that people have returned to their pre-pandemic state of health. And in fact, about a third of patients who've had COVID-19 have residual symptoms, and they're termed either long haulers or suffering from long COVID. And a lot of these people are folks that actually had mild infections. So the disease has potential lingering effects. Next slide, please, Chris. On this slide, I just want to answer the question that Tim posed early on. Is the pandemic decelerating? Is there some light at the end of the tunnel? So first of all, let me just say that yes, the pandemic does appear to be decelerating here in Wisconsin. And there's plenty of evidence that these began to show up about 4 weeks ago. Our daily case counts have been declining and are still declining. Wisconsin hospitalizations have dropped steadily from their peaks 4 weeks ago. We still have a lot of people in the hospital with COVID-19. Our COVID-19 ICU census also has declined, but significantly exceeds the peak of the surge that we experienced in the spring. Our reproductive number, a measure of contagiousness, has been at or below 1 for 4 weeks, although it's not substantially below 1. Our doubling times have stabilized, but are worse than at the end of September. And the 7-day average positivity rates have started to drop, but they still remain high. Our 7-day death rates have started to drop, but they also remain high, averaging 47 deaths yesterday over the last 7 days. And remember that in Wisconsin, deaths seem to lag cases by about 5 weeks. So that means we're probably going to continue to have high death rates, daily death rates, through the rest of this year and possibly into January. Next slide, please. This next slide shows screenshots from the Department of Health Services website, and it tracks the 2-week averages for the case burdens in all 72 of Wisconsin's counties. Now, starting at the left, 4 weeks ago, you can see that 71 of our 72 counties were red. In other words, they had critically high case burdens, and the one remaining county had very high case burden. As you track to the right, with each successive week, you can see a slow shift from counties being in red to counties being in dark blue, indicating that they're shifting from critically high burdens to very high burdens. In other words, we are seeing some deceleration of the pandemic. On the other hand, right now, 71 of our 72 counties have either very high or critically high burdens of COVID-19. So even though we're improving, we're still suffering from a very, very high case burden. Next slide, please. So as I've said, yes, we are decelerating. COVID-19 hospitalizations have dropped. I'll show you the trend lines a few slides later. And ICU census has declined, but I do want to point out that we're at 84%. This still is too high for maximum efficiency, especially when you consider that many of our healthcare providers still are out sick with COVID-19 or in quarantine because they've been exposed to somebody with COVID-19. And our total hospitalizations still remain high at 82.5%. Again, suboptimal and higher than the peaks that we experienced in the spring and summer. So I can go to the next slide, please. Just want to show these trend lines here. I'll start with showing you that we've had 438,895 cases of COVID-19 in Wisconsin. That's shown at the upper side of the slide. Moving to the right, yesterday we had only 2,122 new cases in Wisconsin and 427 in Milwaukee. Those clearly are trending down. And as I said, the case positivity rate remains high at about 30%. Going to the bottom left-hand side of the slide, you can see the trend lines for new cases in Wisconsin since the beginning of the pandemic. And if you follow the red line, you can see clearly that over the last month, we've had a decrease in the daily number of reported cases. If you look to the right side of the slide on the bottom, you can see similar trends in Milwaukee. Now, I do want to point out that although this is promising, with that high case positivity rate, both in Wisconsin and Milwaukee, there's probably a very significant number of cases that simply aren't being diagnosed, either because patients know the symptoms and have decided to self-quarantine, or they don't want to wait for prolonged periods of time in lines to get their tests. And there also are some concerns that the turnaround time for tests is not optimal. I can go to the next slide, please. This slide, again, tracks deaths. And as you can see at the upper left-hand side of the slide, we only have a 0.9% case fatality rate here in Wisconsin, better than the rest of the US, which is tracking at about 1.9%. You can also see, moving to the left side of the slide in the middle, that our worst days have happened within the last month or so. And then going to the bottom of the slide, you can track the orange line since the beginning of the pandemic, shows the 7-day average death rate for Wisconsin. Looking to the right side of that graph, you can see that it appears that the deaths, although they're very high, are plateauing and perhaps might be beginning to trend downward. If you look at the right-hand bottom side of the slide, you can see similar trends in Milwaukee. Now, I do want to caution everyone that this is not licensed to relax social distancing, practicing the 3 Ws, and exercising overall caution. Again, the deaths lag new cases by about 5 weeks. Next slide, please. I also want to show various indicators that we typically report. The reproductive number yesterday was 0.92 in Wisconsin and 0.97 in Milwaukee. That's good, but we really need that to be down below 0.5 for a sustained period of time if we're going to be working towards extinguishing the pandemic. Our 7-day daily growth rates are improving at 0.8 and 0.9% respectively in Wisconsin and Milwaukee, but just understand though that 0.8 or 0.9% of 400,000 cases is still a lot of daily cases. So if things don't change, we're going to continue to have high daily case burdens. And I'd say the same thing for the doubling times at the upper right. 43 days in Wisconsin, 66 days in Milwaukee. These have stabilized, but they were significantly better back in September and early October. I also want to show you at the bottom the trend lines for the reproductive number from one of my favorite websites, rt.live, that allows you to track in real time and compare the R numbers in various states across the country. So if you start at the bottom left, you can see that in Wisconsin, for the last month or so, we've been at or below 1.0, and that's shown in green. If you look at Illinois, very similar trend lines, and the same goes for Iowa. And if I'd shown the Minnesota track, it would look pretty much the same. So a couple of points that I want to make here. It's good if we have statewide coordination of our interventions for COVID-19. It's better if we have regional coordination, because as you can see, our region tracks pretty closely together because COVID-19 doesn't respect state lines and county lines as well. The next slide, please. In terms of hospitalizations, we've had over 19,000 admissions to Wisconsin hospitals with COVID-19 since the beginning of the pandemic. A little over 4,500 of those occurred here in Milwaukee County. Part of the good news is as we learn more about COVID-19 and how to manage it, as we have better testing capacity and some moderately effective therapeutics, the likelihood of you being hospitalized with a COVID-19 diagnosis has gone down to 4.4%. At the beginning of the pandemic, it was nearly 30%. Now moving to the middle part of the left-hand side of the slide, our current Wisconsin inpatient COVID-19 census is 1,471. That's down 95 week over week, but it's still very high. Our highest peak day was 2,277 on November 18th, just about a month ago. And then go to the bottom left-hand side of the slide, you can see that our Wisconsin COVID-19 ICU census is 319. That's down a little bit, 7 week over week. Our peak was on November 16th at 456. And if you look at the right-hand side of the slide and the graph, you can also see that our hospitalizations have been trending down significantly for the last month, but they're very, very much higher than they were during the spring and summer peaks. Trends for the ICU in light blue also going downward, but not as dramatically. We have 238 ICU beds available in Wisconsin for use right now. That's better than the precarious situation that we were in 5 weeks ago when we were down to about 100. Now, because of the pandemic and the high burden that we have, our personal protective equipment trends are worsening. and our most critical needs are for gowns, masks, and goggles, but our supply chain is better than it was in March and April. And I also want to point out, if you look at the bottom of the slide, we have plenty of ventilators available, 1,846 as of yesterday, and that's actually increasing. And I don't believe that ventilators will ever be a limiting factor during the pandemic for our ability to take care of people with COVID and with other diseases. Next slide, please. Now, people ask, why is COVID-19 decelerating in Wisconsin? What's different now than we were experiencing 5 weeks ago? There are three potential reasons, and I will just say up front, these are all speculative. First and foremost is that people are being more diligent about protecting themselves, especially when they saw their ICUs were 95% full 5 weeks ago. And this is most likely a contributing factor. Second is called the low-hanging fruit hypothesis. In other words, the most susceptible individuals have already gotten infected, and their susceptibility will be either because they exhibit less cautious behavior than other people, or they're in higher risk groups. And then the final is very interesting. It's called the network hypothesis. In other words, the idea is that key people who sit at the nexus or the connecting points of different social networks already have been infected. And so they're sort of out of business right now, either in the hospital or quarantining, and they've stopped the spread from one social network to another. This is similar to the idea of herd immunity, which would posit that you need 70 to 75% of the general population to be immune to prevent spread, but it's more focused on individuals who are more socially interactive than others. Now, I do want to say that the deceleration of the pandemic is not likely to be due to herd immunity because we're not close to 70% of the population having been infected. The highest estimates that I've seen for Wisconsin are hovering around 30%. And this is certainly not due to less testing because our hospitalizations and deaths remain very high. The next slide, please. Now, I do want to pivot to the light at the end of the tunnel, the vaccines that are rolling out. As most of you know, the Pfizer vaccine received FDA emergency use authorization last Thursday and is being administered in Wisconsin right now. In fact, the first people that received the shot were yesterday in Wisconsin. I also want to point out that there are several safe and effective COVID-19 vaccines that are in development. The Moderna vaccine received approval from the Scientific Advisory Committee yesterday, and it's anticipated to receive emergency use authorization from the FDA after it's reviewed by the FDA on December 17th. So we expect that there may be distribution and administration of Moderna doses next week. Now, all of you know that initially the doses are going to be limited to frontline healthcare providers and long-term healthcare facilities, such as nursing homes. I want to point out that no single drug company is going to be able to meet the short-term demand. We need many hundreds of millions of doses to vaccinate the entire US. And recall that both the Pfizer and the Moderna vaccines are two-shot vaccines. I also want to point out we have about 400,000 healthcare providers in Wisconsin, about 20,000 physicians and a little over 100,000 nurses. We also have 10,000 individuals who either live or work in nursing homes. And our first batch of Pfizer vaccine is going to be about 50,000 doses, and we may get as many as 100,000 Moderna doses. Obviously not enough to cover everybody that's in those two priority groups. So at least initially, we're going to have to be prioritizing which healthcare providers receive the vaccination. And I want to call your attention to the logos at the bottom of the slide. These are very reputable companies, all of which are very close to marketing vaccines in the US. I'm optimistic that AstraZeneca and Oxford will be applying for emergency use authorization sometime in January, and Johnson & Johnson either in January or February. And those two vaccines are less fragile than the Moderna and the Pfizer vaccine. In other words, their transportation and storage conditions are much more favorable. Next slide, please. Now, will the vaccines be safe? Yes, we believe that they will, and that the risk-benefit ratio to taking a vaccine strongly favors taking the vaccine. The safety and effectiveness of the COVID-19 vaccines is typically assessed through large clinical trials, an independent oversight body, and then ultimately by the FDA. The Pfizer and Moderna COVID-19 vaccines underwent testing in large trials, about 30,000 for the Moderna vaccine and 43,000 for the Pfizer vaccine. And there were no serious adverse events in either one of those trials. However, the trials excluded children under 16 and pregnant women. So we really don't have very much information about kids under 16 or pregnant women. We hope that those studies will be available sometime in January. Now, I do want to caution that there were 2 individuals in the United Kingdom with a history of anaphylaxis. These are people that carried EpiPens for previous anaphylaxis who did develop a severe reaction to the COVID-19 vaccine. So right now, we're cautioning people that carry epinephrine pens or have either food, drug, or ingredient allergies to consult with their provider before they get the vaccine. And ideally, if they go ahead with that, it would be in a supervised setting where they have epinephrine and other medications available to deal with anaphylaxis. I also want to point out that COVID-19 vaccines are effective for diverse ethnic groups. So Black and brown people who are more likely to get COVID-19 and to have severe COVID-19 and deaths. It's been shown that clearly that the vaccines are effective in those groups. Every adult age group, including the elderly, also have been shown to have a strong immune response and protection from the vaccines, as well as those with existing comorbidities like diabetes, high blood pressure, and heart disease. And again, I want to go back to the safety issue. We know that there's a sort of an underlying anti-vaccine group that we're going to need to be dealing with, and also people that have vaccine hesitancy, either because they're from disenfranchised minority groups, or they have safety concerns about the rapidity with which our vaccines have been developed and are being distributed. I want to point out that 9 vaccine manufacturers signed a vaccine safety pledge, committing to make safety a top priority. And these are all the groups that are most likely to be distributing vaccines in the US. I would add that Novavax, which is a US company, is very close to having authorization for distribution in Europe. And I would hope that they would also apply for that. So it's looking more and more likely that with all of these vaccines coming to market, with a ramp up of the manufacturing and distribution, that it's not unrealistic to expect that we could achieve herd immunity in the second or possibly the third quarter of 2021, assuming that people are willing to take the vaccines. I can go to the next slide. What to expect if you're going to get the vaccine? Both the Pfizer and Moderna vaccines and all those in development are given by shots in the upper arm, just like the influenza vaccine. And all of the vaccines coming to market, except perhaps for the Johnson & Johnson vaccine, are 2-dose vaccines that require a second shot either 3 or 4 weeks from the first shot. We do expect that people will have a vigorous immune response, and so they'll feel site tenderness, redness, and swelling in the arm, and systemic symptoms such as fever, fatigue, headache, muscle aches, joint pains, or nausea. That should go away within the first day or 2. And the vaccine provides peak immunity 4 to 5 weeks after the second shot. I want to make sure that everyone understands there is some immunity that's conferred after the first shot, maybe as much as a 50% prevention in terms of getting the infection, but it works best, up to 95% if you get that second shot. And so I also want to point out to everyone that we're going to need to continue to minimize our interactions outside the home and practice the 3 W's: wearing a mask, watching your distance, and washing your hands until at least 70 to 75% of the population receives a vaccination. So I want to anticipate one question that people typically ask about the vaccines. Everyone needs to understand the Pfizer and Moderna vaccine studies only examined people who got sick. They really weren't designed to detect people that were feeling fine who received the vaccine, but possibly could be spreading COVID-19 because they have asymptomatic infections. There are studies that are specifically designed to examine what we call sterile immunity. In other words, people that don't feel sick that have the vaccine but are infected won't transmit that disease to other people. We don't know that yet. So these are reasons why, at least for the foreseeable future, whether you have a vaccination or not, you're going to need to practice the 3 Ws. Next slide, please. This is just a timeline for your reference. You can download that from the chat box. Next slide, please. I also want to just show you risk calculators. We're still in the holiday season, so these 4 risk calculators can help you assess the risk of various activities. I particularly like the Georgia Tech risk calculator because it allows you to focus in on your zip code. But I also want to give a shout out to the Wisconsin Medical Society that also developed a risk calculator. And one that's not listed here that's very popular is the Johns Hopkins risk calculator at their website. And next and last slide just shows the usual data sources that we'll use. And with that, I'll turn it back over to Tim.
Dr. Raymond, again, thank you for the explanation, the information, and especially as the vaccine rolls out. I think that's very helpful to a lot of us. A couple questions. One is, did we really get the surge that was being predicted out of Thanksgiving? Has that shown up or not shown up yet? And what's the forecast for Christmas?
Okay, we haven't seen a surge, so I'll start there. Again, in part, I'll go back to the 3 hypotheses that we had. We still know that the large majority of cases that are occurring in the community are in small gatherings within people's households. That doesn't mean there aren't transmissions in nursing homes and at places of work, but generally it's leisure time activities. So despite the fact that the pandemic is decelerating, people need to continue to practice the guidelines over the holiday seasons to protect themselves and others. And again, I'll go back to, we still have a very, very high burden of disease in the community. So the more you go out, the more people you interact with, the fewer precautions you take, the more likely it is that you're going to either get or transmit COVID-19.
Okay, a second question kind of relates back to the discussion we've had about state fair and what's the future of that as an alternative care facility?
Well, even at the peak, we never had a census that significantly exceeded 20 patients. It was let me have a shout out to the people there. Fantastic facility, great professionals, high quality medical care. And it was designed to decant people that were on their way to recovery anyway in the last 1 to 3 days of their hospitalizations. Never really needed to use the entire capacity of the ACF, but it's still activated.
Can you talk a little bit about reinfection possibilities? Because the information's been mixed on that.
There are clear cases of reinfection. So the simple answer is yes, you can be reinfected, even if you have antibodies. So the immunity is not perfect. And we're not expecting that the immunity with the vaccine will be perfect either. What we're hoping is that if you already have been infected, or if you get the vaccination, that if you get sick, you won't be quite as sick as you would have been otherwise. But yes, you can be reinfected.
And then you noted the lag time or the need to get 2 vaccinations. Are the locations receiving enough vaccine to do the second shot, or does that come in a later dose?
We don't have enough vaccine right now to vaccinate even the frontline healthcare providers. And we're probably not going to have that until January. And, you know, this is a very fluid situation, and the guidance from Department of Health Services changes by the hour. And so I'm not even sure right now if we get 50,000 doses, whether that'll be 25,000 doses given twice to the same people, or 50,000 one-shots, and that we would hope that we would get another tranche of a vaccine within the next 3 weeks.
So as you look ahead, Dr. Raymond, is this going to be kind of a one and done vaccine, or is this something you think we're going to have administered annually like the flu shot?
We don't know, but I wouldn't be surprised if we required an annual booster. And I think most epidemiologists believe that's the most likely scenario. We certainly hope you wouldn't need it more than every year. We hope that immunity will be good enough for a year.
Yeah, and again, I'm asking you questions like you're a logistics expert, but if you get the vaccine the first time, do we know there's enough in the pipeline that when my time comes up 3 weeks later for the second dose that it's going to be there?
Again, it gets back to guidance from DHS about whether, let's say we have 50,000 doses. Do you give 25,000 people the shot and save the 25,000 doses for 3 weeks later, or do you give it to 50,000 and trust your supply chain? I don't think that decision has been made yet. But what I can say is Moderna in particular is ramping up their production capacity, and the US purchased an extra 100 million doses, I think, last week. So if I were a betting person, I'd say give it to everybody that you can and trust the supply chain will bring that second dose in 3 weeks.
All right, then maybe a last question here. The FDA approved the vaccine by a vote, I think 17-4 with one abstention. Do you know kind of who's on the committee and why they voted against approval or who abstained?
Yes, there's a broad representation of frontline healthcare providers, policy experts, ethicists, and epidemiologists. And my understanding is that the people that voted no, for the most part, were concerned that 16 might be too young, that 18 was really the cutoff point that they would have been comfortable with. The rest of the folks thought that because there were very few people between 16 and 18 that were tested in the clinical trials, the majority felt like the biology of adolescents between 16 and 18 was not substantially different, and they were comfortable taking it down to 16.
Yeah, again, thank you very much, Dr. Raymond. And I know you've not only on air, but in the chat box have been helpful answering questions. And just a program note as we turn to Manuel to talk about the future of the economy here, our business strategy webinar for 2020, this is going to be the last one. And we'll start again on a once-a-month series in 2021. And I do want to recognize Dr. Raymond. I think we've done probably more than 250 of these now, and you're very well-deserved recognition as a Business Leader of the Year. You've been just fantastic with the clarity of the information and the directness of your approach, and it's been a pleasure to work with you through 2020.
Likewise, Tim. Thank you.
Manuel, I'm going to start you out with the same hopeful prediction that I did with Dr. Raymond. As we look at the economy, is there light at the end of the tunnel? How long is that tunnel into 2021? And so ask you to use your investment advice and experience to help us unpack what's coming down the line for us in 2021.
All right, Tim, thank you. And again, I want to thank you and Dr. Raymond just for taking the leadership on communicating to the business community all the way since the pandemic with these webinars. Before we jump in there, and I do think I would agree with Dr. Raymond that there is light at the end of the tunnel, even on the economic side. Just by way of introduction, Spectrum Investment Advisors, we're located in Mequon, celebrating our 25th year in business. We've got two key areas that we primarily focus on, working with corporations and nonprofits on their retirement plans, acting as a fiduciary advisor and a consultant, as well as educating the employees, and also working with individuals, families, and trusts on their asset wealth management. On the next slide, we have received a number of different awards and recognition, particularly the local basis from the Milwaukee Business Journal as the best places to work, as the fastest growing firm. At a national level, Investment News and Pension and Investments magazine as best places to work, and MMAC and Cosby as a Future 50 organization. When we look at the question at hand as to where are we with regards to the economy, and you can go to the next slide. Yeah, looking at some of the key themes, and again, there's a gazillion different things that you can look at, but we're just focusing on 4 key areas here, and then turn the page over to 2021. But when we're looking at the market and the recovery that we have seen in 2020, we went from having the worst GDP on record in the second quarter to having the best GDP on record in the third quarter. We've seen the market recover. We see the market hovering around 30,000, at least the Dow Jones is. And so we have seen a very strong recovery. However, that has been led by a key few sectors, and it has been somewhat of an uneven recovery. We're starting to see a little bit of a shift on that, but technology, areas that have taken advantage of the recovery with regards to the pandemic, whether it's delivery services, things like that, that have done really well. What prompted all of that, what helped all of that was the government stimulus package. So the CARES Act signed back in March, that $2.4 trillion package, which part of that was the PPP, the Payroll Protection Program, really gave a boost to companies to be able to maintain their employees and to continue to push forward and carry them through those summer months of uncertainty and really distress in the economy. With regards to the employment numbers, obviously a number of areas have been hit really hard, particularly restaurants and the more of the areas where people would be from travel perspective, casinos, things like that have really gotten hit very hard through this. And so we've seen a recovery there, about 54% recovery of the jobs lost in February and March. Again, we've seen a big surge on that. We're starting to see a little bit of a softening here as we have seen more of the cases surge nationally. I know Dr. Raymond talked a little bit about Wisconsin. It's holding up better than the nation, but we've seen an increase down in the southern states. We're likely going to see a wage increase of 1.5% year over year by the time this is all said and done. And again, what the Fed is doing, Fed is meeting today and tomorrow, coming out with their remarks tomorrow, likely going to continue an accommodating policy that will keep interest rates low for longer. How they manage inflation is going to be something to watch, how they manage their bond purchase program, and how that push interest rates on the long side of the curve will be something to keep watching. Obviously, there's a number of other areas to look at, from the election to supply chain to global issues with regards to what has been happening with the economy, but these are some of the key areas for 2020. So as we turn the page to 2021 and look at the outlook for 2021 on the next slide, we look at the COVID vaccine. We just spent a number of minutes talking about the vaccine and the Operation Warp Speed that the government has put into place. Some of the first doses are already out. We're looking at 100 million doses by the second quarter, maybe another 200 million doses after that, which again, if you have the double dose issue, which a lot of unknowns around that, maybe by the end of June or by the third quarter, we have about 150 million Americans that could be vaccinated. Now, there's also a Gallup report that says only about 63% of Americans would actually get vaccinated right away. So there's still a lot of unknowns out there, not only from the demand for it, but also the production side and the number of doses to be taken. What is going to help us into the new year is going to be the government stimulus number 2. Basically, government is working on a new package that we'll likely see before Christmas, maybe as early as this Friday. It's a $700 billion to $1 trillion package, primarily focused on the unemployment benefits that are set to expire on December 26th. A lot of small business aid there as well. Depending on where the politicians agree on this package, there may or may not be additional aid to the state and local governments. There's still some uncertainty around that, and also around some of the legal protections for corporations with regards to COVID. When looking at the financial markets themselves, we'll likely see continued momentum into 2021. We may take a little bit of a pause here again, as we've seen the unemployment numbers not as strong. We'll have to see where the sales number comes in for November and December, but we'll likely see with the vaccine a speedy recovery and see corporate earnings start to grow into 2021. And we'll likely see the market recover and continue to be have strong momentum into the new year. So again, that light at the end of the tunnel. From a market strategy, you have to really be strategic about your fixed income allocation, how you do that within your retirement plans, your personal planning. Just because of where interest rates are moving, and the amount of risk that could be in that fixed income side. One key area about this is that this is an uneven recovery. What we have seen is that the top 20% earners in this country, because of their lower expenses, because of their telecommuting, working remotely, not going on vacation, things like that, they have saved about $1.3 trillion in cash. As soon as they feel comfortable with traveling and going out and doing some of the normal things again, you will see a huge demand out there for some of the high-end services from some of these top earners. And so that's going to be interesting in how the production keeps up with that demand. What makes it uneven is that the lower income families have had about a 20% job loss, but they have maintained about 100% of their pre-pandemic spending, particularly because of the unemployment benefits. So in this recovery, we may see the top side, the top earners having the stronger recovery and higher spending, leading the markets and leading the economy moving forward. So what we're thinking about here and what we're suggesting and where we see the shift is focus on training and education. So as we look for strategic initiatives for companies into 2021, on the next slide, we're looking for companies that have positioned themselves. Maybe they've taken the cost-cutting measures in 2020. They positioned themselves to do some capital spending to prepare themselves for recovery, take really advantage of this low interest rate environment that's likely going to be here for longer. Also, the importance of training and education, focusing on employee training, because it's likely going to continue a tight labor market for skilled workers. So we've seen, obviously, the Amazons of the world filling in the warehouse type jobs, but the key high skilled workers are still in high demand. It's still a very tight labor market. So it's important for companies to invest in their employees to continue to increase the capacity and the skill of their employee workforce. And then from an investment standpoint, risk appropriate investment, as you look at the markets, not to get overly excited about the markets, at the same time, not to get overly emotional. We saw a lot of people that either through the COVID pandemic at the beginning freaked out and moved to cash, or made emotional decisions based on where the election might have gone one way or the other. So let's make sure that we keep emotion out of the equation and keep an eye on the different sector rotation, as we've seen the market led by the technology side. And we're starting to see a shift towards more what you'll find your traditional value categories with financials and some of the areas that got harder hit. As they see a recovery, they'll likely bounce back stronger into 2021. So again, we'll likely see the light, as we said, at the end of the tunnel, and likely see a stronger economy. But it's important for companies to take advantage of these opportunities and make sure to train their employees because of the tight labor market. And the last slide we have is just, again, we're available. There's information. We've got a number of resources available on our website, spectruminvestor.com, a number of webinars that we have also hosted, and information with regards to the markets, the economy, and retirement plans in general.
And well, thank you very much for that crisp, focused report on what we can look forward to in the economy in 2021. And maybe one question before we go to Brittany here. Would you say your biggest concern going forward is what everybody's described as this K recovery? And you outlined that pretty well with a lot of high income earners with a lot of dry powder to spend, but we've got a lot of people in the economy that have lost the job and are going to struggle to get back into the economy as it continues to slowly evolve in 21.
Yeah, and and I want to give kudos to MMAC, Greater Milwaukee Foundation, and other area groups in Milwaukee that have really taken a step forward in between the Hispanic Collaborative and other initiatives to really bring up the skill set of the employees, because yes, that is a concern. On the one hand, it's going to be positive because there's a lot of dry powder to be spent and a lot of money to be spent in high-end products high-end demand. But yes, we have a concern about that lower tier of our earners, and making sure that we keep a more balanced approach going forward. And also, even from the access to healthcare and all these other things, access to the vaccine, again, kudos to the work that MMAC and others have done to really be more, across the board, really put initiatives in place to help the entire region move forward here.
Yeah, Manuel, thank you very much. I appreciate it. Brittany Lopez, now let's turn to you. I guess if I'm continuing my analogy of light at the end of the tunnel, there's still plenty of concerns for employers as they move through this COVID tunnel. And you're going to help us unpack some of those and understand what some of the issues are.
Yes, thank you, Tim. I'm happy to be here today. And as Tim mentioned, I am an employment attorney with Reinhardt Berner Van Duren. I work on various employment and OSHA issues. So basically anything that touches the workplace. So the biggest question that I'm getting, and I think a lot of you may be struggling with, is what to do with the vaccine. If you are in charge of a company, or if you are in HR, you're considering whether or not to mandate that vaccine. And it is permissible to mandate the vaccine if you choose to do so, but it's definitely something you're going to want to spend some time assessing various considerations. First of all, what is the exposure risk at your workplace? Are you a high risk, congregate setting, or are you more in offices where there's a lower risk of exposure? The other big consideration is what is going to be the impact on your employee morale of mandating a vaccine. Manuel mentioned the Gallup polling showing that almost 4 in 10 individuals have said that they are not planning to get the vaccine, whether it is for safety concerns or you see higher levels of concerns in groups that have been disenfranchised. So you want to make sure that if you are going to mandate a program, you have considered the impact of potentially having to keep a large number of employees out of the workplace who choose not to get that vaccine. As any mandatory program, there would have to be some discipline imposed for not complying with the program. So consider whether that is appropriate for your workplace and whether you could operate with people out of the workplace. Any mandatory program would need to be implemented consistently to avoid claims of discrimination or retaliation. And any mandatory program would still need to address accommodations for requests under the Americans with Disabilities Act. So as Dr. Raymond mentioned, there are going to be individuals with who carry EpiPens who may not be good candidates for this vaccine. Pregnant women, if you happen to employ anyone who is younger, those may be all issues you would need to consider. And also there are requests for accommodations for sincerely held religious beliefs under Title VII that you would also need to consider. And there are differing standards for whether such an accommodation would pose an undue hardship for the employer. So you're going to want to make sure you're considering requests under the right standard. Another big change for employers are the reduced quarantine times that were recommended by the CDC about 10 days ago, and the Wisconsin DHS implemented them or encourages local health departments to abide by those as of December 7th. And so that recognizes that while there is still a risk of developing COVID for the full 14 days, it imposes a large burden on employers and individuals to be quarantined for those 14 days. So an individual with no symptoms can leave quarantine after 10 days, or there's an option for after 7 days if they received a negative COVID test that was conducted on day 6 or later. The Wisconsin guidance permits that test to be a rapid test, although the PCR test is preferable. And this is an option. So you again want to assess whether that is appropriate for your workplace. Does the potential risk of shortening quarantine outweigh the benefit of having people back in the workplace? So that might be very depending on your setting. And again, if you have people that are using the shortened quarantine, making sure that they are just being extra vigilant about what Dr. Raymond referred to as the 3 W's, wearing a mask, keeping your distance, washing your hands. Obviously, everyone should be doing that, but particularly for people who are still within that 14-day window after an exposure. A couple other things that are on the horizon: the Families First Coronavirus Response Act. The paid leave under that act is set to expire on December 31st of this year, and we haven't yet seen a plan for expansion or extension or renewal of that. We may not see that until after the new administration comes in, so keep your eyes out for that, but also make sure that you remember that those benefits expire on December 31st, and in its current form, there's no obligation to pay out those benefits. And one thing that may come up for employers with the last couple weeks of the eligibility for the benefits is requests for leave on the basis of a child's school being closed. The school being closed qualifying reason needs to be because the school is closed for COVID related reasons. So if someone's child is home because their school is closed for winter break or, you know, the normal kind of holiday, those would not qualify for FFCRA leave. So make sure that you are confirming that when an employee is requesting leave. Two other topics I just want to quickly touch on. We're seeing a surge in employment litigation related to COVID-19, whether it is requests for leave that weren't appropriately dealt with, or allegations of retaliation for raising safety concerns in the workplace. Since March, there were about 20 lawsuits filed in March, and there were several hundred filed in October. So we're going to continue to see that ramp up. So just make sure you are properly assessing leave requests. Any COVID-19 precautions and policies are being implemented consistently across your workplace. And if you are making a break from a policy, make sure you're documenting why that's being done. Final, one thing I want to touch on is OSHA. OSHA has 6 months to issue citations, so you have a bit of a lag between when the pandemic started and when you started to see OSHA citations. They've issued about $3.5 million in citations. A lot of those have gone to healthcare settings and may deal with respirator programs. So if you have employees wearing respirator programs, it's critical that your program is compliant, that you are doing all your fit testing and medical evaluations. But for all other employers, another big issue is making sure that if you have an employee with COVID-19, you are assessing whether or not that case of COVID-19 is work-related. And if it is work-related, that you are tracking it on your OSHA logs if you're required to keep those. And if there is a fatality or in-person hospitalization, that you are reporting those to OSHA within the timeframes required. So those are kind of the big things we see coming up in employment law.
So, Brittany, thank you. Very, very, very helpful. A question for you, because I've seen this in employers in other countries, and now I'm seeing this crop up on college campuses, where in the college campus case, the students are required to take a test or be tested a couple times a week. Then it's on their phone, and then while it's on their phone, there's a proximity alert if they're near others who don't have a test. And so I'm curious as to, if an employer required that, how would you advise them on that? And are we getting into some privacy issues when we talk about those types of applications?
Yeah, there's definitely a number of issues that are going to converge. I mean, I think one of them is obviously employee privacy. There are questions of making sure you're protecting your employees' medical information. So while HIPAA might not cover most employers, they still have obligations under the Americans with Disabilities Act to make sure that they are maintaining employee medical information confidentially. And the other big question is just a practical question of how is that going to affect employee morale. You know, if they feel like they're being tracked, are they going to be concerned that that data may not be being used appropriately? That's going to be a really big issue also, is making sure that these changes or these programs are not going to undermine your workplace culture.
Yeah, and I quite frankly, I was kind of surprised at your answer that an employer could mandate somebody getting a vaccine. In a normal year, could an employer mandate that people get flu shots?
So they can. There is obviously, as I mentioned, there are exemptions from that if you need a accommodation under the Americans with Disabilities Act or under Title VII. But there are certain facilities, such as healthcare facilities, that may have a mandatory flu vaccine program. I think most employers won't mandate that program, but they may strongly encourage it, and they may facilitate it by having flu vaccination clinics on site to promote that.
Yeah, employers have certainly kind of ramped up their protocols for good reason during COVID. As we kind of come through this in 2021, are there some of those protocols that you see sticking around with employers?
Definitely. I mean, I think one of the big ones is going to be an increase in remote work, or, more flexibility with schedules. I think that a lot of employers have spent time revamping their flexible work and their telework programs to ensure that they are providing the flexibility employees need, but also making sure that they are complying with requirements such as the Fair Labor Standards Act. So making sure that you are paying employees for all time work, because if people are at home, they may be, particularly for those who are hourly, if you're checking email, you're working and you need to make sure you're getting paid for that. So I do think remote work is going to be a big change. And I think we may see different policies for, when people are ill, some more flexibility to be home then too.
Yeah, and some of that, again, the practice in the office setting now, you're talking about some of that will transfer now to your remote location and where you're working remotely.
Yes, definitely. I think with remote working, making sure that if you have a lot of employees accessing your network, making sure that your privacy settings, that your security is all up to where it needs to be. These are all other things that employers are considering that are great, from a practical standpoint, to make sure that you've kind of done that review.
Good. Well, Brittany, really helpful practical advice as we look forward. And I appreciate you taking the time and sharing your expertise with us, along with Manuel and Dr. Raymond. So again, this will wrap up our 2021 Business Strategies webinar series. We'll start again in 2020 with a once-a-month cadence on January 12th. And again, if you want your fix of Dr. Raymond, we're both on the air on Tuesdays at 4:20 on WTMJ. So have a very safe rest of the year. Manuel, thank you very much. Brittany, thank you very much. We appreciate you both coming on, and look forward to a healthier and safer 21.
Thanks,
Thank
Tim.
you, Tim.
Thank you.
Thank you, everybody.